Hello and welcome to my channel. My name is Dr. Shiva Aslanpour. I'm a doctor of physical therapy, and today I would like to talk about some exercises that can be helpful in improving knee pain and stiffness.
Okay, let's go.
Specifically, if you're having office work and you have to sit for long hours, you might feel more knee pain and stiffness by the end of the day. So today I would like to go through some exercises that includes hip and knee mobility, strengthening your lower extremity, working on your core and balance. Please follow me to the end. I'm going to teach you a technique that you can stretch your knee capsule to have a better range of motion. You need a towel like that, and you roll the towel and you put it under your knee, okay? And in this position, you grab your ankle by both hands and you're trying to pull it toward yourself as far as you can, and it's not severe pain. It's not causing a severe pain for you. So you hold it and you relax. You hold and relax. You will find this exercise really beneficial if you are having a problem with bending the knee all the way. If the range of motion is more limited, so you cannot do this. It's not doable, because you need at least to have like 100 degree of flexion to be able to do this exercise. So try it and let me know how you feel. One good practical exercise to improve your hip mobility, which is hip control articular rotation. This way, if your hips are stiff and you are compensating by your knee joints, that way you're resolving the problem, and you wouldn't put extra load on your knee anymore, and that can make your pain go away. So you can do this exercise in standing position. Also, you can do it in kneeling or quadruped position. Since we are talking about knee pain here, I would rather do it in a standing position. A kneeling and quadruped position might be too much on your knee if you're having pain. So start with standing. If you wanted to do it in other positions, as long as it's not painful, that's gonna be fine. So hold on to something sturdy to be sure that you are doing it correctly. And in order to perform this movement, you stand in one leg and you bring the other heel up, you bend the knee, and you go as high as you can. When you reach your limit, you start moving your knee out, so your leg goes to the side. In this position, you start moving your foot toward the back and kicking without bending your body forward. So it's only from the hip joint. All the movement that you are doing should be through the hip, and you shouldn't compensate by keeping your body to the side or bending forward. So you bring the knee up, it goes to the side. I'm moving my foot back, kicking back, and bringing my knee next to the other one. Again, I kick back, I'm going to the side, going down. Another good exercise that you can practice to improve your lower extremity strength and at the same time working on your core and balance is crab walk. You can do it with a band around your ankles, or you bring the band above your knee. The lower bands goes, it gets more difficult and it puts more strain on your glute muscles. So just do it in a way that is still challenging for you, but it's doable, and you are able to perform this exercise for at least 2 minutes. My knees are relaxed. I'm tucking my tailbone and keeping the back flat. So I'm not arching it and I'm not slouching. So I'm trying to hold myself upright. I'm trying to brace my ab, keep the ribs down, and in this position, then without putting extra load on my knees, I'm walking toward the side. So this is a really good exercise that you can perform if you are having hip pain or knee pain, or you want to work on your core stability. So when you are moving, I want you to lift the leg, go to the side, and take another step instead of shuffling like that, okay? And it's important that you stay in the middle. Don't shift your weight when you want to move toward the opposite side, because that's one way to compensate. So it's important to brace yourself and stay in the middle and trying to engage more abs. As long as you are engaging your core, you're gonna have more stability here. When your pelvic floor muscles are stable, you will be at lower risk of getting injured in lower extremity and in your lower back. The next exercise is squatting, and you are leaning on the wall to make it easier on you to squat down, and also make your knees and your hip ready to be able to squat down. And you need a ball. It's good to use something squishy that you press your knees toward it, and it will be some sort of resistance for your hip adductors. So in this position, you keep the ball between your knees, you press your knees toward the ball, and you're trying to slide down. You can go as far as you can, but you should feel pretty good stretch on at 90-degree knee flexion. In this position, you just slide up. Just remember that it's not supposed to cause any pain on your knees. So if it's painful, you don't need to go down too far. As long as the pain is lower than 3 or 4 out of 10, it should be fine to do it. You can perform these movements 3 sets of 10, and whenever you go down, pause a little bit.